Welcome to The Conversation with Dasha Burns. I'm Dasha Burns, White House bureau chief for Politico, and every week on this show, I invite one of the most compelling and sometimes unexpected power players in Washington and beyond in for a chat to find out how they're navigating and shaping this incredible era of American politics. This is the first episode of our podcast, and I am thrilled to share it with you. Today, I'm joined by Dr. Mehmet Oz, heart surgeon turned celebrity physician turned high-ranking Trump administration official. Dr. Oz, once known for his eponymous daytime talk show, entered the political arena in 2022, running and losing against John Fetterman for a Pennsylvania Senate seat. And now he's overseeing the nation's Medicaid and Medicare systems. I wanted to know how he's navigating his new role and the incredible amount of responsibility that comes with it. Plus, he's somebody a lot of people think they know, but I wanted to dig into the man behind the celebrity. Here's my interview with Dr. Oz. Thank you for joining the conversation, the first conversation. We are experimenting with kind of this new approach to the Sunday political program.
I'm glad you're doing it, Dasha, because I think you have the right personality to get folks to talk about what the real issues are.
I told him to say that.
Yes. But it actually is critical because especially in health, where our major goal, for example, with the MAHA movement is to get especially MAHA moms energized to get their kids healthy. That's not a right or left issue. That's not Republican or Democrat. Everybody wants their kids to be healthy. They're 25% of the population and 100% of the future.
Well, and I think that in this administration, there are so many people, forces of nature behind these cabinet roles, right? And you're certainly one of them, and you have a lot planned. I want to know, what is harder, open heart surgery or navigating the bureaucracy?
Well, I mean, open heart surgery is harder, just objectively speaking, because when you make a mistake in open heart surgery, someone dies. And so you have to live with that. And that is actually one of the hardest parts of doing medicine, is having a bad outcome and moving past it. In government, it's a interesting dynamic because you have people who are incredibly insightful. I mean, that's probably the biggest surprise of all of serving in government, and I've not been in government prior to this administration, is people, especially at CMS, have deep talent, deep wisdom, passionate about the job, very mission aligned. I mean, they came into the government thinking they could fix Medicare or Medicaid or the exchanges.
Right.
And it's hard to do that, but they're just undaunted, and they're just power through all kinds of obstacles. If you really want to get proud about America and our government, and I know many people aren't right now, reputationally, it's all
but the brand isn't good.
The brand, but that stated, if you come in and just spend a week working with government, it's not quite what you might think. I mean, most people probably imagine Zootopia with the sloth going.
Well, I think people
slowly.
Either think there's utopia or that it's just like deep state bureaucrats that want to destroy the country, and
I'm not naive to the possibility that they're there. That's not the argument that I would make. I would say that within government, and I'll just speak specifically to my entity of CMS, the Centers for Medicare and Medicaid is a very technical spot. You have to actually know how to calculate an actuarial table. What's it going to cost to take care of people if you pay this versus that? What's the best way to align the federal government with the state government?
So you need some people that are careers that have that experience and are passionate about it,
and
too,
you want them to feel that they're free to move forward. That is probably the biggest compliment that I get from the career staff here is you're letting us feel like we matter, like we can actually get stuff done. No one wants to come work in government and do nothing. Why would you take that job? And I don't think they do it for the paycheck. At least the people that I'm working with. I'm speaking very specifically to folks who have dedicated themselves to helping other Americans get healthy or avoid critical mistakes that cause death.
Did that surprise you at all, though, given how so much of the narrative has been that the government is so full of people that are barely doing any work, that aren't interested in working? Because it sounds like where you're at, it's quite the opposite.
Well, in fairness, by the time I was confirmed by the Senate, much of what needed to happen from the perspective of DOJ had already occurred. So I inherited an agency that had already gone through some loss of personnel and some streamlining of operations. But that's not the part of the story that resonates to me. The part that captured my attention as soon as I walked in the door was that there's really an opportunity, generational opportunity, to improve the care that we're giving to Americans.
But it's the execution that's often the challenge, because there is this hot political environment that makes it difficult. I want to go back to how we first met, which was on the campaign trail in Pennsylvania during the Senate race in 2022, your first foray into politics. You've gone from running for office to now you are like deep in Washington waters. And what did you learn from running for Senate that you can bring into maybe getting a little more politically savvy in this role?
Well, the message matters a lot. And for the message to be correct, you have to really believe it, which means you've worked it out in your own mind. You can't be sitting in an armchair in some faculty lounge smoking a pipe and think you understand the problems of folks who are unemployed in Appalachia. You actually have to go to those areas, talk to those folks, understand what the motivating factors are. But you also have to pull in allies, which is also true whether running for a campaign or actually acting on a victory and leading government. Sometimes stuff breaks when you try to make a difference.
Yeah.
And I don't want people playing defense.
Are you scared of the breaking, or
No.
are you down for
Not at all.
a little
I'm not scared of the break.
trouble?
In fact, I've told the team this multiple times. If we get everything right, we didn't take enough chances.
Having been a public figure for so long, you've seen your share of incoming criticisms of what you've said or done on your shows and of course, during the campaign. Does the criticism feel different, though, given the level of scrutiny that is on this administration right now compared to the scrutiny you faced as a TV show host?
The best metaphor I can give you is a samurai sword. I don't know if you know how they make a samurai sword, but they take a piece of metal that's relatively malleable, and they hammer it. And they fold it over, and they hammer it flat again. And they keep folding over this long metal sheath and folding it and hitting it and hammering and heating it and beating it until finally it gets steeled. It gets really hard. And I've told this story around my wife before, so I'll share it with you because...
Sorry, Lisa.
That's right. So this wedding ring that I have, that I've had on for 40 years now, so 40th wedding anniversary this month.
Congratulations.
Thank you. And
Are you doing anything nice for her?
Yes, of course, but don't tell her. I'm sure she's going to watch this.
We won't ruin it on the podcast.
Right. But so I remember going on my honeymoon, and I sat in the sand, and I got up, and I noticed there were scratches in my wedding ring from the sand. And I thought, what a fool I am. How did I already scratch up this brand new wedding ring? Everyone else I know, all the men I know, wear these wedding rings that are completely shiny and spotless looking, and I mucked mine up in several hours. But by the time the vacation was done, a couple days later, I had scratched the ring so much it was shiny again. And I think it's a good metaphor. In the beginning, you hear things, harsh criticisms that are uncomfortable, but over time, it doesn't really matter because what you're aiming to do is so much more important than any criticism you could face, that it actually steels you against that criticism. And that's what I've told the team as well. We're going to have incoming. Much of what we want to do matters. If it matters, someone doesn't want it to happen. And not everyone's innocent. They're clearly financially motivated actors who will manipulate the truth because it serves their interests. I've made the argument in the Senate hearings, there are probably 150 people in America who make most of the decisions around how the health of this country is delivered. It's not that many. Those people are sometimes a force for good, sometimes they're not. But no matter what they're doing, they definitely have to take care of certain stakeholders. And so my job is to try to call balls and strikes and make a system that is safe for everyone to compete. And we are open for business. I want the private sector involved. I want insurgents, incumbents. I want them all coming in. We'll talk about some of those initiatives. But there is no question that along the way, there's going to be some feelings hurt.
Well, one area where you're doing that, and I know the president is really keen on this, is the drug pricing. He signed an executive order giving drug companies 30 days to electively lower their prices. I mean, when you look at the Hill, so many politicians have had very cozy relationships with pharma for a long time. This seems to be like an early strike at Big Pharma to say, hey, we need to do something differently, something you probably don't want to do. How do you bring them into the fold?
Dasha, they might not want to do it, but they know it has to be done.
Do they?
Yeah, they do. We've started having these conversations, and if you get them in a quiet moment and you share with them what the president said at that executive order press conference, they can't defend the fact that drug prices in America are 2, 3, sometimes 4 times more than other countries that are equal in wealth to us. They can't defend the fact that 2/3 of Americans who go bankrupt have a health issue that drives that bankruptcy. They can't defend the fact that 1/3 of Americans, when they go to the drugstore, don't pick up their medications because they can't afford them.
They can't defend it, but that hasn't stopped them from wanting to seek the profit before.
Which is why the president is so important in this process, because the president is a spectacular negotiator. And he has made it abundantly clear in many other areas that he's not kidding around. This is a very, very bold, very brave executive order. And what the president has said is he wants equalization. If you objectively look at this, it is impossible to defend the current situation with drug pricing in America.
Well,
so the question,
crazy. Everyone I know who has prescriptions to get filled is shocked by the cost.
So that stated, and recognizing, as the president said, that the lifeblood of innovation comes because you have an opportunity to be different and change the world, and there's a financial motivation often there as well. We want pharmaceutical companies to thrive in America. In fact, we want more pharmaceutical companies to come to America from other countries. But we have to build a system that's sustainable. And so when you go to a pharmaceutical executive and you share these realities with them, they'll nod their head yes, and they'll agree something has to happen. Then the question is, what needs to happen? This is where the president's art of the deal comes in, because the pharmaceutical executive challenge is not just what happens in America. Remember, 70% of their profits are made in America, even though we're only 4% of the world population. And we're funding all the research. So what is the right number? Well, they'll say, well, can you help us in Europe? Can you help us in Asia? We get beaten up there. People don't pay us what we should get paid. They threaten to take away our patents. The Chinese are invading our intellectual property, literally hacking our inventions, and then massively overloading the patent office and the FDA with petitions to take over businesses that are American innovations. Help us. These are not things we can do by ourselves. Protect us overseas.
So those are the levers you can use. Because I was going to ask about enforcement, because we're in a free market, right? You can't just tell drug companies you got to lower costs or else.
Well, it's a free market for the voluntary element of this, which is what we're trying to do. And I'm confident that there'll be some opportunities that the pharmaceutical sector is going to grasp onto. They need help with their negotiations overseas. And what the president has said over and over again is we want the equalization that happened during NATO. What happened in NATO? He went to Europe. He said, guys, we're not going to pay the entire bill for you to protect yourselves. So if you chip in a little more, we'll chip in a little less. It'll be sustainable.
How involved has he been? Has he been talking to you directly about this?
Oh, very much. You want to get an early morning wake-up call? Get involved.
Really?
Get involved in most favored nation drug pricing. He's very animated about this, and he has for a long time. This long predated his involvement in politics. He's made the argument around drug pricing, as most people have who think about it, for decades. But it seems to fall on deaf ears for the reasons I just outlined. There are some parts of the healthcare system that are so ingrained into how we make political decisions. Pharmaceuticals are not the only one. I mean, there's probably 5,500 hospitals in America. That means every congressman has at least 10 hospitals in their district. That's a lot of clout. So it's hard to change these elements of our communities, and so if you're going to make a difference, you have to be very thoughtful about how you do it, but you also have to be willing to take some chances. So when the president says, I'm going to give what is perhaps, and I believe it is, the boldest move in pharmaceutical pricing in this healthcare sector ever in American history, which I think was what he did with the executive order, then there are going to be people who criticize you. And then you got to come through, which is why he keeps joking with me that, that the pressure's on.
The pressure is on because it's a huge deal and it would make a massive difference for so many Americans. The other thing that is potentially going to impact millions of people is the One Big Beautiful Bill. The House has passed it. And there are concerns from Republicans in the Senate about cuts to Medicaid. Josh Hawley, in particular, said that if Congress cuts funding for Medicaid benefits, Missouri workers and their children will lose their health care and hospitals will close. It's that simple, and that pattern will replicate across the country. Do you share that concern with Hawley?
We're not cutting Medicaid. I've seen the proposals. There is no proposal I've seen, in fact, fairness, that doesn't increase spending on Medicaid. So what this government is going to do.
So why are people like Hawley concerned? Because there's been a lot of confusion about the cuts. What do you read as his concern?
If you read the actual language that we're working with, it is designed for one major purpose: to allow the President of the United States and the governors who run the states to align on what we should be doing for the most vulnerable members of the population. In my campaign 2 years ago with you, in my Senate hearings a couple months ago. It's a similar refrain for me. Every great people take care of their most vulnerable. And we're a great nation. We're going to do that. So there's a lot of sensitivity about being accused of not taking care of people who have disabilities or seniors without money or children. I mean, 50% of kids in America are on CHIP, Children's Health Insurance, or Medicaid. Half the kids. So we want to take care of folks who are not owning a big part of the economic pie of America. That stated, you have to make the system viable. I'm trying to save Medicaid. That's the president's goal as well. He said over and over again, he wants to love and cherish these programs, and we need to keep them viable. So, for example, take what's being called the work requirement, which is really a community and engagement.
That seems to be like the biggest part of how you want to kind of cut and cull this program.
It is from a pure money standpoint. But let's just go through this exercise here, because 80% of Americans agree with me and the president on this. If I were to tell you, you're sitting at home, let's say you get home, forget about you get home after this interview, and there's someone that you don't know sitting in your living room on a sofa. And Spooky, right? And then you say to them, well, let's just have a conversation. Do you have health insurance? He says, yes, I have health insurance. And to keep my health insurance, I either have to volunteer for a job, right? Go try to get a job somewhere. I don't have to get a job. I just have to try to get a job. I can volunteer some other charitable endeavor. I go get an education, or I can take care of someone in the household that needs me, a child. Or if you're willing to do any of those things, you can keep your health insurance.
I think the concern that some advocates have raised, though, is the administrative effort to manage that, to make sure that people are filling out the paperwork, to verify the paperwork. And some are concerned that that is going to mean that some people lose their health insurance, and even for a time, if it means a delay in critical care, that could be.
Dasha, it's an excellent question. But this is where I do think we have an obligation, all of us in government, to do a better job.
Yeah.
If the reason not to do something that we all think we should do is we don't think we're capable or competent to do it, that's a problem.
Do you think CMS, with its resources right now, is going to be able to support that kind of administrative load?
Yes, and we're going to try to help the states with some of the infrastructure, like the IT infrastructure that we're already building out. We have a major initiative. Again, DOJ's helped with this. Amy Gleason's leading the effort. And we have already put out a document telling the entire nation, those involved in information technology, that we're open for business. Come on down, because we're going to build an incredible effort around a healthy ecosystem for IT. So if you want to build apps to talk to people about health, if you want to give decision support to doctors, if you want to help patients find the right place to get care, if you want to just give them advice about taking better care of themselves, this is the time to get involved. We're getting all the data that's already out there that the patients have accrued in hospitals and doctors' offices and the pharmacies. We're ensuring that data flows back to a central place, or in a way that we can get access to it. And then building out tools that we want the private sector to contribute to, so that everyone can get better access to their health care. My job as the administrator of CMS is to be able to talk to you, Dasha, about things that matter to you if you want me to. And I should empower you, or someone who's on Medicaid or Medicare, to talk to us and get your questions answered if you need them. We're going to do that. Along with that advancement, we can do all kinds of things, including helping people decide, if they've tried the work, what to do with that information. How do you feed that back to the state?
When do you think that system is going to be in place? How soon can you bring that to fruition?
Within a year. The minimal viable products will be released.
Because the thing that I worry about, I had an appendectomy recently. Not fun. I don't recommend it. 0 stars. And my experience with it was more striking in the ER, because it's a great hospital. I had wonderful doctors and wonderful care, but it is slammed. Every room is full. I was in the hallway in a bed with a bunch of other people, some of whom were in emergency situations like me, needing emergency surgery. Other people were there because they don't have a primary care doctor and just needed a checkup. Other people were there because they needed a meal. And if a bunch of people get kicked off of Medicaid, even if it's because, a lot of people agree with you, they're not working. They should be working. Why should taxpayers be supporting healthcare for someone who's not participating in society? But we're going to have to pay for them anyway, right? If they end up in those ERs, and more beds are going to get stacked, and that staff is going to get worked to death.
Yeah, I don't want people dropping off Medicaid.
Yeah.
It's a very important program. if we can get people to move from Medicaid into the exchanges, because they do go out and try to get a job. And because of that, they make enough money, they qualify for the exchanges, which, by the way, the federal government will pay for almost all of your premium if you're on an exchange program, a crutch to get you from Medicaid into the employer workforce or insurance or to Medicare. But you have to help yourself a little bit. Dasha, this is much bigger than just the money.
Yeah.
If you're a doctor practicing in rural America, and there's a lot of folks that in your environment that are on Medicaid, it's, let's say, 1 in 7. You got to take care of them for basically free, because a lot of doctors don't. I never charge for Medicaid. There's not enough money it's not worth it. But if I now come back to you and say, you know what, I decided to expand Medicaid, and we just doubled the number of people on Medicaid. Now it's not 1 in 7, but it's more like 1 in 5 or 1 in 4 of the people you're taking care of needs to be on Medicaid. You just leave. So we're having a problem with enough practitioners, providers to actually give the services to people. So you can't overwhelm the system by pretending you're giving people insurance when what you're giving them is just a chit to go gambling at the doctor's office. We have a very inefficient system with administrative costs through the roof, wasting doctors' time. They spend as much time on paperwork as taking care of the patients.
Does it make you mad? Because it makes me mad.
It makes it, but those are all fixable things. We want to unleash incumbents and insurgents, private companies, public company, doesn't matter. Companies that want to go out there and make a difference. We want to create a place where they can actually start to reach for the stars. Build a safe ecosystem where they can start going in there with easy access to data, which right now is not available. Those are things government has to do. We have to make it easier for the information that around people's health to be accessible to them because they own it.
Is that AI?
AI will be a big part of it for sure. Think about this. When you try to, I'm going on Medicare in a couple of weeks, right?
You're going on, oh yeah.
I'm 65 this year.
I was going to say,
forget my boyish
can I
looks.
ask your age?
I'll be 65 on June 11th. Right?
Wow.
So I'm eligible.
Happy birthday.
Thank you.
Almost.
So fascinating thing is if you actually try to get into the system and sign up like you should, it's not as easy as it could be. Much of this is going to be changed dramatically over the next year. You'll be talking to an avatar and it'll be asking you some basic questions because it knows about you, and you'll be helping it ask better questions. And if you want to, by the way, you can opt out of this whole thing.
I get to chat with an avatar?
You'll be able to chat with an avatar. And how advanced it is.
Can it make my avatar like a Dr. Oz?
Yes. And I'll take the appendix out ahead of time.
I do want to take a little pivot into you, because a big part of what I want to do with this show is give people a sense of the why behind the person that is having such an impact. So I see an Emmy back there. You were a very successful TV host. You were a very successful surgeon, but you are a novice in politics. Is it weird to be new to something for the first time in a long time? And why the hell are you doing this?
It is exhilarating to learn new things, especially if you think you can help. All the things you just mentioned, I was new to when I started them. I still remember the very first time someone called me Dr. Oz, and I looked around because I thought they were looking for my father. So when you first become a physician, it's daunting. And you work your tail off because you appreciate the responsibility, the honor that society bestows on you with that title. When I started doing more television, your field, I was definitely a novice. But I had great mentors, and I tried to learn as fast as I could, and I respected the field. It is definitely the same when you walk into government. The folks who are doing this are professionals. And they might be forces for good or evil. That part I'm not going to try to convince the listener or viewer. But there's no question they're good at what they do. So if you want to make a difference and you think you got the guts to take on some powerful forces and you can withstand the pressure and the criticism, and I'm at this point in my life, I'm mostly thick skinned with some hair on top. But you just tackle it and off you go. And the beautiful thing about learning new skills is you meet new people. And I think it is one of the blessings of life that most of us have the ability to be lifelong learners. So take the wisdom that you've accrued earlier in your life. You may not make decisions as quickly as you used to, but you'll make them better because you can educate that decision process with things you've learned, because experience only comes from bad mistakes.
I do want to ask about Harvard, because they've obviously been in the headlines. You went to Harvard, Penn. You're kind of a high pedigree gentleman here. Your father, also born in Turkey, came to the U.S. for medical school. Like, you and your family are kind of the prime example of the benefits of having smart, hardworking people from other countries come to the U.S. to pursue the American dream. right now, the Trump administration, it's on hold with the courts, but is trying to ban Harvard from accepting international students. Do you worry that the sort of ratcheting up of these sorts of threats might prevent other people from having the kind of American dream you and your family got to have?
Not at all. They'll come, and they're great places for them to get educated in. My father came to this country, he'd been educated on scholarship and was educated during the Second World War, when Turkey might have had the best medical schools in the world because all of the physicians from Central Europe, especially Jewish physicians, had been forced to flee. And Turkey was a country that would take them in, and they knew they'd be safe there. And so my dad was educated by these great German, Austrian, Jewish doctors, and America followed the quality of the education in Turkey and recruited physicians. My dad was top of his class, recruited to come here. We're still
Should the
doing
U.S.
that.
keep doing that? Should that continue to be a priority for us?
Oh, it should. We will continue to train the best and brightest of other parts of the world. We want there to be a brain drain towards America from those nations. But there's been a change in my alma mater, Harvard, that anyone who went to school with me would have to acknowledge. We witnessed our school lose its way. And it did it for a bunch of reasons, and that's a whole separate podcast discussion. Yeah. But I've been involved at Harvard. My kids went to Harvard. I've been proud of my affiliation. I still am with the university. And there are many people like me who are graduates of Harvard who desperately wanted to go back to what it was really good at. A meritocracy where thoughtful people, listen, I was a Turkish immigrant's kid. My dad grew up on a dirt floor. No one from my family had ever gone to Harvard. My dad knew of Harvard because even in Turkey, they knew of Harvard. And he was the only school he wanted me to apply to. And it changed my life completely that I went there. I want others to have that opportunity as well. I helped develop and improve the website at Harvard to help recruit more folks for outside the typical feeding grounds.
So should Harvard be able to recruit international students with vetting and all of that? But should that?
I think that will happen over time. But this is a bigger discussion about what is Harvard willing to do to truly represent the best interests of its students and the American people. And if you're going to take money from the federal government, it's not unreasonable to expect there's some strings attached. If what you're endorsing and embracing is toxic ideology against what in the best interests of the country, you should at least be able to defend that's the right thing to do. You don't get to just do that, sit in a $53 billion endowment and take federal funds. I would argue, for example, that many of these institutions, and I think mine is a good example, others should be included, have become large hedge funds with small educational annexes. I mean, $53 billion is a lot of money. It doesn't cost $53 billion or even the interest on $53 billion to run the institution. So if you were to take the 1,600 students of my graduating class, that's the number, and compare it to what graduated this year, it's about the same number, we should be dramatically increasing the number of lives that we change, the number of kids that we help.
I have one philosophical question that I've been very curious to get your take on, and it's the do your research mantra that has entered our popular vernacular. Clients, customers, patients now have all this information at their hands to be empowered when they walk into their doctor's office or the supermarket or what have you. On the other hand, there's a lot of crazy shit out there. As a doctor, how do you feel about the do your research thing?
When I started my show, this is 15, 16 years ago now, that was an area of contention. Why was Oz getting all these people to ask extra questions? I know it's a hassle when you go into the office for a clinician and the patient's got a lot of questions. But if you want to get a really good patient who follows through on everything you advise, get them to do their homework. Because they'll begin to embrace what you're saying because they truly believe it in their hearts.
Where do you think they should do their research, though? Because there's so much politicization of just about every institution at this point that I think it's hard for people to know.
I think the NIH under Jay Bhattacharya is doing an excellent job of trying to provide a objective perspective on what's going on. The FDA under Marty Makary is doing the exact same thing. There are large academic entities, the Cleveland Clinic, Mayo Clinic, that have great source of information. Obviously, you can talk to your doctor and quiz them, but don't just walk in there as chattel. The word doctor comes from the Latin doctore, teacher. We're supposed to be educators. You don't go to your class and just take as dogma everything the teacher says. You listen to what the teacher's offering you. You make some decisions about what the parts that you really are engaged in, the parts you might have questions about. You're informed in the whole process. The beauty of being alive in 2025 is that we have so much technology coming to aid us if we're curious. But let me end on this comment, 'cause I think it's probably the most important thing I'll say. If you want to know what MAHA really is, if you want to know what CMS is trying to do and Bobby Kennedy at HHS and all the other agencies, it's trying to fulfill this fundamental concept, which is be curious. If you're looking at what MAHA stands for, it's asking you to be earnestly curious. Remember, most 80% of questions are statements in the skies. Are you really curious? So you actually want to know the answer. Are you courageous enough to take whatever you learn when you're curious and tell people what you learned? Because it's tough sometimes. You can be intimidated. We don't want that. We want you to be brave and stand up for yourself. And are you compassionate in how you deliver? Because people don't care what you know till they know that you care. So be courageous, right? And be compassionate. But to do those things right, you first have to be curious. And that's what we plead for everyone to do. I believe I'm a curious person. That's probably what I have been by people who like me.
Me too. Yeah. I think that's what I
right.
that's what I hope I'm described as.
People who like me usually say, that's probably a little thought exercise everyone can do. Ask your 3 best friends in one word to describe why they like you. And if they, whatever that word is, that's who you should be. It's your best. Good luck with your program.
Thank you so much. I really appreciate you doing this. Thank you. Thanks so much to Dr. Oz for joining the conversation. On each show, I'll also be joined by one of my colleagues at Politico to give you a behind-the-scenes look at one of the big stories of the week and share the inside scoop on how it all went down. In a moment, I'll be joined by senior legal affairs reporter Kyle Cheney to talk about the showdown between the federal courts and the White House over Trump's tariffs. But first, Politics Bureau Chief and senior political columnist Jonathan Martin is out with a juicy column this week about the Ohio governor's race that really captures the zeitgeist of the moment and features Elon Musk, Vivek Ramaswamy, and the battle between new Republicans and old Republicans for the future of the party. I had to hear more about his wild story, so I convinced J Mart to hop on the phone in the middle of his vacation in his hotel lobby. Here's what J Mart told me.
I discovered that there is a fun caper unfolding in Ohio, or at least potentially unfolding. The governor there, Mike DeWine, also known as Ohio's grandpa, Governor Sleepy T, was a bespectacled, unassuming 78-year-old, actually a fairly crafty politician, not enamored with the idea, this won't shock you, of being succeeded by Vivek Ramaswamy as governor of Ohio. And so DeWine hatched this plot to find a different successor. Well, that began with J.D. Vance's seat in the Senate being vacated. He appointed his lieutenant governor, John Husted, to that open Senate seat, which then vacated the LG position. And what did DeWine do? He found a former Ohio State football coach, Jim Tressel, Dasha, to become his lieutenant governor. Well, he didn't tell Tressel at the time, but he's been working on him since, is, don't close the door on running yourself in 2026.
So he conspired a plan for Tressel without telling Tressel.
Yeah, he didn't want to scare him off. He just said, do your duty for the last year and a half here of my term. He's term limited, DeWine is. And so he's done in 26. Now, of course, ever since Tressel became LG, DeWine's been working on him with the hope that Tressel will, in fact, run in his own right. I talked to Tressel, though, Dasha, when I was in Cincinnati. He was non-committal about running. So we'll see.
So this plan may or may not work. Another great detail in your story is the caper starts with Elon Musk when he was seemingly part of every political story.
The Elon cameo, Elon was eager to get rid of Vivek from Doge. And in fact, Vivek didn't even last until Trump's inauguration. He was the first casualty of the new Trump administration. He didn't even make January 20th. Elon got tired of Vivek pretty quickly. And so Elon calls Governor DeWine and urges him to appoint Vivek to the Vance Senate seat, the vacated Senate seat in Ohio, ostensibly so we can have appointment for Doge here in the Congress as we do this important work to cut government. But Elon being Elon, he can't help himself. And like a few minutes into the conversation with DeWine, Elon blurts out that he finds Vivek annoying. And that's the actual motivation for trying to get him out of Doge.
A huge thanks to J Mart for taking the time out of his vacation to talk to us. And if you haven't read his column yet, you definitely should. You can find it at politico.com. And now I want to bring in another colleague to talk about the big legal and economic news of the last week, which was centered on two major judicial decisions. The first was by a 3-judge panel at the U.S. Court of International Trade, which struck down the vast majority of President Trump's Liberation Day tariffs. And that was followed by a federal judge in D.C. who, in a separate case, ruled against the president's use of emergency powers to justify his tariffs. Now, a federal appeals court has temporarily reinstated the tariffs that were struck down by that first court, but the whiplash has sent the White House and the markets into a tailspin. Joining me to tell us how this is all playing out behind the scenes is senior legal affairs reporter Kyle Cheney. Kyle Cheney, my friend, thank you so much for joining us to talk about this monumental and really complicated moment in the relationship between the executive branch and the judicial branch. I want to pick your brain about both what's going on and kind of how you personally as a reporter have been navigating all of this.
Well, thanks so much for having me, and I'm glad to be part of your first episode.
This is so timely for you and for everyone that gets a chance to hear from you, because there is a lot going on in Trump legal world. And I want you to give us the big picture of the origins of some of these federal cases against Trump's tariffs, and when you realize that this might be sort of the big deal that could stop Trump from pursuing the tariff agenda.
Sure. I mean, even zooming out even further, a Trump relationship with the courts, that is the story of this administration, the battle that's going on right now between these two branches of government, with Congress kind of in the back being sort of supine, and Trump is the only obstacle to his agenda really are the legal limits, and the court saying you're crossing those legal limits time and again. And the tariff story is part of that narrative now, and in a big way. I mean, we've seen a lot of clashes over Trump and immigration, his mass deportations getting stopped. This is the first time where a central plank of his economic agenda has been stymied by the court. And we had this Court of International Trade, which even a lot of lawyers didn't know existed.
What is this?
It is the court that is designated, it's based in New York, but it is designated to handle matters of international trade. And so it is a U.S. court. It's not an international court, but it deals with matters related to our government's separate trading partners and trading policies. And so a lot of times it's very minor thing, very technical issues over the way the government enforces its trade policies that don't rise to the level of sort of general significance. But now we have the president making sort of an unprecedented use of his tariff authority, basically saying we have multiple national emergencies going on that trigger my emergency authority to issue tariffs, all kinds of tariffs on Canada and Mexico over fentanyl trafficking, tariffs on all of our trading partners because of our trade deficits, which he categorizes as an emergency. And therefore, I can essentially levy tariffs at will on our trading partners. And the court basically said, no, that's just not true. Congress never intended to give the president that kind of blanket power. And now the ruling essentially undermines this whole Liberation Day, the entire Trump, ethos of tariffs is the way to go. It's kind of turned his whole party on its head. It's turned the international trading system on its head. All of that goes away under this court's ruling. So that's why the administration is treating it like such an emergency, and they're racing to appeal.
You're always watching the dockets. You're watching what is being filed. When did you realize just how big of a deal this tariffs case would be?
The tariffs one was a trickier one because we just had no sense of where the court was going to land. And so you hear the arguments say, look, if Trump loses this case, it's a huge deal, but we don't know. We can't get a read on where the judges are going to land. Sometimes you can tell from the arguments and the papers how the judges are leaning. We had no clue here. In fact, Trump himself wanted this court to handle the case. I think he felt like he had a better chance in this court than he did in some of the other districts where these lawsuits were being fought. In fact, there's another judge who ruled against the Trump tariffs in the D.C. court. The Trump administration was saying, hey, don't rule on this. We want to send this to the trade court. We think they're going to do a better job, and they actually should be the ones to rule. Well, it turns out he did no better in the trade court. And so that's why I think we all had this sense that maybe Trump felt more confident about how the trade court was going to come out. And that's why when it came down and they sort of thoroughly rebuked his tariff authority, everyone sort of had whiplash. We said, whoa, that's not what we expected in this forceful of a way.
It's funny because you watch what's actually happening in the courts and how Trump's team is dealing with these things in the court of public opinion. And sometimes there's overlap there and sometimes there's not. So like right now, Caroline Leavitt, the press secretary, Stephen Miller, and others on Trump's team are going after the judges, saying that they're railroading these trade negotiations. What do you hear from your judicial sources about this approach from the Trump administration and how they're talking about and dealing with the judiciary?
The issue for judges is they really only speak through their rulings and through their papers. They don't do a lot of interviews. They don't do a lot of responding to the political attacks. And that's by design. It's both to maintain some neutral distance from the issues that they have to rule on. They understand to a degree that politicians use them as targets and fodder for their attacks. This is sort of an unprecedented time because when Trump attacks them, number one, it raises the temperature in a way that leads to actual threats against the judiciary, which they're very cognizant of. And
I think Stephen Miller just said, quote, "We are living under a judicial tyranny."
The rhetoric is sort of another level than we've ever seen, even in the first Trump administration. It's a judicial coup. It's this language of violence almost that is alarming, and it's meant to alarm. And really, it's the bottom line is we don't like the rulings, therefore it's tyranny. The administration is appealing them. They can win. They could win on appeal. They could win at the Supreme Court, and that's really how you're supposed to respond to adverse judicial rulings.
And they are doing that. They are doing those things simultaneously, going through the traditional legal process.
Exactly, and as you pointed out, like there's a divergence between how DOJ messages these things in court to the judges who they need to rule in their favor, and how Trump and Stephen Miller talk about it. And what we're seeing increasingly is the judges are noticing that. They're saying, okay, Mr. Justice Department attorney, you're saying it in a very nice and pleasant and polite way. But when I turn on the TV, I have Stephen Miller and Donald Trump screaming about judicial tyranny and coups and saying something very different than what you're saying to me. And that affects their thinking. And they can't separate that anymore like they used to. And I think it's having an impact on the actual outcome of some of these cases.
So looking ahead for Trump's tariffs, what's next here? Are there other ways that the Trump administration can pursue their tariff agenda outside of this avenue that the court has said is not going to work? Like, what are legal experts saying about that?
Well, so we're sort of at the beginning here. I mean, what happened was the administration appealed, and the appeals court actually put a stop to the underlying ruling. So the ruling that blocked Trump's tariffs is now on hold. And so basically it's the status quo. The Trump tariffs remain in effect, possibly for a very short time. This is just sort of the appeals court's trying to wrap its head around the issue and decide, do we let that lower court ruling take effect and block the tariffs or not? But we need time to think about that, at least a week or so. And so I think, that's the first hurdle is does the appeals court let these tariffs stay in effect or not? And that's a matter that'll take, again, a week. Then there's the longer term question of do the tariffs take effect over the course of this longer legal battle that could be months, if not a year, to resolve.
And Supreme Court, how likely is it to ultimately land there?
The Court of Trade the appeal of that goes to the court, the Federal Circuit Court, which is another sort of rarely heard from federal appeals court that deals with a very narrow set of issues. How those judges weigh this, again, unprecedented use of tariff authority, emergency power. I mean, I do think the Supreme Court will have an interest in weighing in on the president's ability, unfettered or not, to declare emergencies and then act on those, invoke emergency powers in ways that give him these emergency authorities, and whether there's any limits to that.
Kyle, before I let you go, I want you to bring to the proverbial table your favorite dish that you had in DC, like a favorite meal. I'm a huge foodie, and I'm obviously new to Washington, and I want to eat the favorite things that you have eaten.
All right, let's see. I'll try to do you justice here. Best restaurant I've been to recently is Ellie Bird. It's sort of this award-winning restaurant in Falls Church, so just outside the DC Arlington area.
What kind of food?
It's sort of seasonal. They change their menu constantly, and it's just always like the freshest ingredients, and it's amazing. I had I think I had an Amish chicken they called it the other day, and that wasn't a particularly memorable dish, but it was delicious, and everything they do there is delicious and fresh. So
Ellie Bird, Falls Church, Amish chicken. I love an Amish chicken. Kyle, thank you so much for your insights on the law and the restaurant scene.
Anytime.
Appreciate you. This has been The Conversation with Dasha Burns. We'll be back next week. If you want to catch future episodes of The Conversation, be sure to click the subscribe button below. Thanks for watching.